Well, good afternoon. Let me see. Good afternoon, Carrie. I am delighted to once again welcome this group to Kentucky and to focusing on the mobility, economic resilience, and substance use disorders of our folks in rural communities. We at Rural Development understand that for our communities to be strong and vibrant places to live, we have to have the support of everybody in that community. We need the participation of all the folks in that community. We need folks like that to work and to bring their talent to their jobs and creations of jobs in our rural communities. And so Kentucky is very proud to be a part of this effort. And I want to thank Carrie and NATO. I want to thank our area development districts that are participating. They have always been on the front line with rural development as we try to tackle the challenges that have faced our rural areas. And when I came to this job in 2017, I was thinking of all the things that we would do. There would be broadband, and I get that's a part of somewhat of transportation anyway, but all those kinds of things, water. And all of a sudden we were just hit with this priority that was from the White House through USDA on down to focus on, at the time we called it the opioid epidemic. And of course, it's substance abuse across the board now. I continue to be able to work with the former Governor Fletcher in his endeavor to tackle some of the issues on substance abuse. And it raised a real awareness from my staff about the fact that when Kentucky was ranked so high in the number of people, counties who were incredibly negatively impacted by the substance abuse issues, we knew we had to roll up our sleeves and do what we can. And so some of the things that rural development, through the help of area development districts and some of you out in the field have been able to do, we actually have been the first state in the nation to actually take some of our single family housing homes that have gone into foreclosure status and convert them to a transitional housing. It's not transportation, but it's one of the things you wouldn't necessarily think that rural development had done, but we've been very proud of that status in the country. I think there's only 2 states that have been successful, and we were the first to do it. It also, we have spent much of our community facilities money on organizations with our small grants that have gone for equipment. We certainly have bricks and mortar in terms of our CF loan programs that go into building buildings. And we've also purchased vehicles that can transport folks to and from their destinations. We have a traveling unit that goes around one of our counties and deals with substance abuse, needle exchange, all of those sort of things. So we really at Rural Development want all of you all to know that we want to be your partner. We don't have a particular pot of money that comes down, but I have been able to prioritize some of our existing funds that goes to substance abuse entities, and you get additional points when you are competing for those grant and loan dollars from our pool of money. So always think when you have a challenge that has to deal with substance abuse in your community, is there a way for rural development to be a part of it? And if so, there's many of my specialists across the state that'd be glad to work with you and talk with you, as well as myself. On transportation particularly, I want to mention that about 2 years ago, we received a priority from our community facilities program to put a priority on transportation. My first resistance, I've got to tell you, was transportation. DOT's got a lot more money than rural development. Why am I going to fund transportation? But since that time, we have been looking and seeking projects where we could assist. You know, the old farm to market roads used to be the way our people did their commerce, and they had to be good. They had to get in and out the hills and hollers or the muddy back roads into the economic centers to trade, to buy, to achieve certain levels of education, et cetera. And today we know that that farm to market road really is broadband. So in addition to investing in our transportation modes, again, the vehicles that we can help transport folks, or we've been able to add on hangars to small airports. That may not be substance abuse, but at least somebody was coming to us with a transportation project. And so we were being able to talk it up and say, yes, we did one this year. So just keep us in mind in regard to that. And we can, we have applied some money where we could fix a bad place in the road that wasn't overly expensive or a culvert or something like that. Those are possibilities that I always wanted someone to bring to us that might be helpful. Broadband is truly, I think, one of our greatest transportation modes. And of course, our distance learning and telemedicine, I am very proud of what we've been able to do. We're awaiting round 2, but round 1 of this year with telemedicine, I think there were 116 awards made nationally. If you take 50 states, that averages about a little over 2.3 apiece. And so we were, really anxious to hear. Well, Kentucky brought home 7 of those national awards, and 6 of them were telemedicine, with only 1 being an education exchange. And I think either 5 or 6, I have forgotten exactly, were all had a substance abuse or an opioid component to it. So we certainly are about the mode of connectivity being a part of transportation, as well as the road systems or vehicles, whatever the needs are, to help bring these residents that are valuable assets with their talent and their skill sets to local communities to be productive citizens. And we are very pleased to have the opportunity to open this. And I get to hang with you a little bit longer today, Carrie, to hear some of the participants. But just to all of you for what you do day in and day out in your jobs to help make these rural communities a better place to call home, and more vibrant from an economic standpoint, a healthy standpoint, and a quality of life. I just say a sincere thank you, because I believe that when our rural communities are strong, then truly America is strong. So thank you for what you do. And thank you again, Carrie, for the opportunity to welcome you today. And good luck on all that you achieve out of this effort.
Thanks so much, Hilda. And we've had a question for you in the chat already. What's the best way for people to get in touch with you and your staff?
Okay. Phone number 859-224-7300. And if you call in and you get someone on the line, you can ask for me. If you don't get anyone answering that phone because of the COVID teleworking effort, and we have to communicate through our computers of Jabber, but we do have hiccups. If you do not get through that effort, I want to know that. And so you send me an email if you aren't able to reach us by phone. And the email is Hilda, hilda.leg@usda.gov. Hilda.leg@usda.gov. And what we have we have offices across the state. And so most likely, if you get someone to talk to, you might just give them your location and say you'd like to talk to someone. Primarily, it will be generally the start would be the community facilities program or community programs that we have. So ask for that location and phone number of the office, and the community facilities person to be closest to you. And if that doesn't work, you call me or email me directly.
Thanks so much, Hilda. The vast majority of our attendees today are from Kentucky. If you are attending from another state and you're not sure, just Google USDA Rural Development and the name of your state, and you'll at least get that main office phone number pretty easily online. And then you can get in touch with the folks in your state as well. The USDA is such
want to be in every state. Yeah.
Right. Yeah. USDA is such an important partner for regions and communities for those innovative projects, like you mentioned with the recovery housing, but also for just those economic development building blocks is really important to regions and communities as well. So thank you so much. We're pleased to have you as such a strong partner in the work that we do as well.
My pleasure. Thank you.
So I'll continue by introducing the rest of our project partners. In Kentucky, we are working with the area development districts that serve the counties in southeastern Kentucky. On the line today, we've got Joe Jacobs from the Big Sandy Area Development District, and I've also worked closely with Cumberland Valley Area Development District and Jessica Blankenship there, as well as Eunice Holland with the Kentucky River Area Development District. And our technical assistance team includes the organization I work for, the National Association of Development Organizations, or NATO Research Foundation. On the line today, we've got Rachel Byerly and Austin Barrington, as well as the Western Transportation Institute. We've got David Kack, Natalie Vilwalk-Whitty, and Carolyn Klauser today, and National Rural Transit Assistance Program. And we're joined by Robin Phillips, Nellie Kubihiro, and Neil Rodriguez will be joining us really shortly if he's not already on the line. To walk through today's agenda, we're going to be focusing on recovery and how best to support individuals in recovery and how mobility ties into that issue, with a mix of presentations and discussion. If you have any questions, please go ahead and pop those into the chat as we walk through the agenda for today. And then we'll be doing some breakout group discussions later on where we'll get an opportunity to talk with each other. I want to talk just briefly about economic resilience. We talked about this a little in the first workshop 2 weeks ago as well. The idea of economic resilience is a little bit broader than economic development, going beyond job creation and retained. And that's an important thing to think about when we're looking at substance use disorder. That huge increase over the last few decades that we have seen in communities being affected by substance use disorder has been driven by both supply side and demand side factors. Many of those are really out of our hands to do anything about, but one of those demand side factors that is important to the work that many of us are involved in is community economic disadvantage, being something that through economic research has been found to really affect people in communities. Economists have found that both at the county level and at the state level, economic impacts that are affecting people have resulted in increases in those diseases of despair, suicide, and addictions, as well as fatal overdoses. On the flip side, having a resilient economy can provide some protection for individuals that are in the community. We've seen that particularly in industries that employ lower skilled workers, that regardless of gender, regardless of race, all individuals working in those industries, in communities that have those industries, have seen a protective effect by having a more resilient economy. So there's this relationship between labor force participation and substance use disorders and substance abuse, that when we can build up labor force participation by offering those opportunities, not just for jobs, but for wealth creation, then we're seeing lower levels of substance use disorder. So strategies that seem to be effective are really developing talent, focusing on those individuals and helping them to develop skills and to get into jobs and to keep stable jobs, and offering opportunities for local wealth creation, the local ownership and control of the productive assets and of businesses in those regions. So that's why we've structured our agenda the way that we have today, looking at both the macroeconomic and the microeconomic, at the family economic success, how individuals can participate, as well as looking at the bigger picture about retaining businesses. So some of the sectors that may provide opportunities for the local wealth creation as well as employment creation are already existing in Kentucky. There are a lot of people who are already involved in these industries. A lot of the work the area development districts and other partners are doing are in these industries that already have a lot of assets, that already have a lot of knowledge and a lot of people working in them. So any way that we can support growth in industries like these, then we're likely to be creating that local wealth that can create that protective effect against substance use disorder. So that's at the macro level. I want to turn now and talk more at the individual level. So I want to welcome Alex Elswick. Alex is an extension specialist for substance use prevention and recovery at the University of Kentucky and has some information to share with us about that.
Thank you so much, Carrie. Well, welcome. And thank you for having me. My name is Alex Elswick, and I'm an assistant extension professor at the University of Kentucky. My research focuses on long-term recovery from substance use disorders, so I'm in my space right now. I've had the benefit of learning about addiction and recovery from a lot of different experiences and a lot of different perspectives. So I started my professional career in a clinical program as a marriage and family therapist, where I learned to work with individuals and families and run groups. And then I worked briefly at an outpatient treatment center that provided medication for opioid use disorder, and I learned a lot about the value of medication there. I'm a co-founder of a nonprofit organization called Voices of Hope. This is maybe the only shameless plug I'll make for our organization. So I'll say what we do is build recovery capital. What we do is the focus of our discussion today. And then in the work that I do at UK, I teach classes on addiction. I do a lot of this, a lot of community work on addiction, and spend hours and hours poring over literature on addiction. And all that's wonderful, but I think far and away the most important experience I have is personal experience, because I'm a person in long-term recovery from an addiction to heroin and subsequently to Oxycontin and subsequently to heroin. And recovery capital has a lot to do with why I'm here today as well. So what I want to do is start by zooming way, way out, as far out as we can go before we zoom in on the resources that people need. And the first thing that I want us to think about is the spectrum of substance use. And this is kind of foundational to substance use, but it's something we don't think a lot about. And that is the fact that substance use exists on a spectrum, a broad spectrum that ranges from beneficial use to problematic use or substance use disorder. And all of us, virtually all of us, use substances every day. I've had a considerable amount of caffeine already today. That's a stimulant, make no mistake, right? So it's important to acknowledge that. And then to acknowledge that when we're talking about problematic relationship with substances, we're talking about a small percentage of people who are using drugs, because the vast majority of people using substances are doing so without problems, without interference in their lives, in social and occupational functioning. And that's even true for drugs like crack cocaine and heroin, which have become so stigmatized that we've become led to believe that these are drugs that only cause addiction. Right, so we're talking about folks who exist at this far end of the spectrum, about the 10 to 15% at the end of the spectrum. And if we do an even deeper dive on those folks, we find that a majority of people who are in recovery today get there without going to formal treatment. So stop for a second and think about that, because I can tell you the first time I heard that statistic, I didn't believe it. I reread it a couple times, and then I went and looked for research that corroborated it. And indeed, it's there. As it turns out, the majority of people who are in recovery today got there without any formal help whatsoever. So about 50% of people who have substance use disorders never saw a therapist, never went to treatment, never saw a psychiatrist, never went to an AA meeting. They recovered unassisted. Sometimes you'll hear this called spontaneous remission, but I think that's kind of like a poor rhetorical choice, because people don't spontaneously get better, right? It happens organically, it happens naturally, and that's why I prefer the term natural recovery. For people with alcohol use disorders, it's 3/4, 75% of people with alcohol use disorders who are in recovery today, who are in remission, got there without formal help. So already, I think those are significant statistics to stop and just consider. What are the implications of those? Well, one of the most significant implications is that we can't just rely on people coming to treatment in order to interact with people with substance use disorders, because such a substantial percentage of people who are addicted in your community are never going to interact with a treatment center. So one of the lowest hanging fruit, one of the first questions to ask is, how are we resourcing those folks who aren't coming to our treatment centers? And then when we do a deeper dive, it gets worse, because we talk a lot about the treatment gap, right? So it's often cited from a recent national survey on drug use and health that there are about 23 million Americans in the United States with a substance use disorder today, and only about 2.3 million, or about 10%, are going to receive treatment this year. So that means 90% will go untreated. And we scream from the rooftops, this is a treatment gap. And that means we necessarily need more treatment dollars and more treatment beds. But hold on a second, let's do a deeper dive on the data. When you ask those folks why they won't receive treatment this year, about 90% say it's because they don't need it. So we have a problem there. Certainly some of those folks are people who are experiencing like ambivalence or denial, and probably do have severe substance use disorders that require treatment. But a majority of those folks are telling us that they don't need treatment. And so we have a problem. right? How are we going to interact with these folks? How are we going to provide services to these folks? How are we going to reduce the harm to society caused by drug use if these 90% of folks we're not even interacting with, right? It gets even worse when 38% of that 90% say the reason they won't get treatment this year is because they don't want to be abstinent. And we reach an impasse in society when it comes to that issue, because as a society, we say, we're not willing to work with you unless your goal is to be abstinent. It's the keystone of Alcoholics Anonymous. It's sort of the keystone of medical practice, the way we address addiction. Abstinence is the only goal. But if 38% of those folks say they don't want to be abstinent, we have to find a way to interact with them. We have to find a way to serve them or resource them, or at least mitigate the harm that may be caused by their continued drug use, right? So the answer, when we look at all this and we say, how is it that a majority of people can recover without treatment, right? That belies our understanding of this chronic, progressive, and fatal disease. Well, the answer is recovery capital. And I could give you the 2-hour seminar on recovery capital. I'm trying to give you the 2-minute version. So recovery capital is like other forms of capital. So when you've heard the term capital, you've either probably heard it in the context of financial capital or social capital. It's always a reference to resources. But in this case, recovery capital is a reference to recovery resources. So it's the totality of resources that a person can leverage to support their recovery from a substance use disorder. And so you see that kind of displayed in the graphic on the right. And most of these resources are very logical. As far as the what here, I'm probably not telling you anything that you don't already know. We're talking about having stable housing, having reliable transportation, taking care of physical and mental health, having good relationships with family members, having a sober social network, right? Having reciprocal social obligations, all these things. And so if I were to give you like truly the one sentence version of what is recovery capital, what people in recovery need to be healthy are the very same things that every other human being needs to be healthy. And so that's why I also put up this graphic of Maslow's hierarchy of needs. I don't know if you all were exposed to this in school somewhere along the way, but basically, Abraham Maslow was a sociologist who said, in order for us to reach our full potential and become the human beings that we're meant to be, we have to have our needs met, and they have to be met ordinally. They have to be met in order, right? So you have to have your basic needs met before we start worrying about your self-esteem. And if you think about it, it makes perfect sense. I was homeless throughout a lot of my addiction. And when I was sleeping under a bridge in Dayton, it wouldn't have made a heck of a lot of sense for you to pull up next to me and start trying to build my self-esteem while I was flying a sign on the side of the road, right? You may have been more concerned with addressing my basic needs. And this is obvious. And in many ways you go, well, this is obviously what we should be doing, but we have to stop and ask ourselves, is this what we're doing? And are we doing it effectively? So let me back up for a second and let's talk about how, because when I first introduced recovery capital, a lot of times I think people hear that and think like, well, you're not telling us anything we don't already know, right? Housing, transportation, mental health, these are all things that we know are interrelated with substance use disorder. But recovery capital isn't just about providing the what, it's also about how it's provided. And so I want to explain that by kind of taking us through how society has addressed addiction over the last 70 years. So first of all, beginning with Nixon and really with Reagan, we started waging a war on drugs, which we know has been a pretty epic failure. We've seen sharp increase in rates of incarceration to the point where we incarcerate more citizens per capita than any other nation, and yet we've seen no appreciable reduction in substance use, which is very much a hallmark of a failure. And so sometime later we said, we got to stop addressing this as a criminal issue, start addressing it as a medical issue, right? So we started getting people into treatment, and make no mistake, that's a step in the right direction, but we still have some inherent problems. One would be incredibly high relapse rates for people following treatment. Number two would be the fact that the majority of people who have substance use disorders are not accessing treatment at all. So that means the vast majority of the impact of substance use on society, we have no bearing on, right? And so the latest shift, sort of the latest evolution where we want to go towards building recovery-ready communities is what are called recovery-oriented systems of care. And folks give whole day workshops on ROSCs alone. So I'm doing all of this, not giving it its due, but couple things to point out about the ROSC that I think are interesting. First of all, the focal point of the recovery-oriented systems of care is the person, right? And I would argue that the focal point of the war on drugs was a jail cell, and the focal point of our kind of existing paradigm is a treatment center. We always feel like we just need more treatment beds and need to send some more people to treatment. But what natural recovery teaches us is that not everyone needs treatment. And so let me be clear as a disclaimer, absolutely some folks need treatment. There are absolutely folks who have severe substance use disorders, complex trauma histories, complex mental health problems, folks like me who absolutely required inpatient treatment. And I'm not trying to diminish that at all. And so you'll notice that treatment is a component of a recovery-oriented system of care, but it's not the focal point. The focal point is, how do we build resources around this individual in the community where they live, right? So I'll give you a kind of another analogy for thinking about this. One of my first jobs in recovery was working in a tobacco field. Actually, in the College of Agriculture at UK, we were trying to develop kinds of varieties of tobacco that had less carcinogens. And I was just doing the manual labor. I know nothing about that. And we would develop these different varieties and take them into a greenhouse in these float trays. And the weird thing about these greenhouses is these tobacco plants would just grow and thrive, right? Because there's these climate controlled environments with air quality control and constant access to nutrients and water and sunlight, the plants would thrive. And when they reached a certain point of maturation, we'd load those float trays onto trucks, we'd drive them out to a field, and we'd set the tobacco. And if the plants had access to enough nutrients in the soil, they'd grow and thrive. But of course, if we planted them in diseased soil or didn't give them enough care, they would wilt and die. And hopefully you can see this as my analogy for treatment versus recovery, because a treatment center is very much like a greenhouse. It's climate controlled recovery, right? Because you have access to shelter, to food, to educated counselors, to peer support, to all the interventions. And guess what? People thrive in recovery, in treatment. People thrive in treatment. The vast majority of people are utterly abstinent while they're in treatment, right? Treatment works. The problem is, we know that addiction is a chronic disorder. We can't keep people in treatment for 5 years. That's untenable. So what we have to do is say, there's a critical thing that's happening when folks are going to transition out of treatment, or the folks who never go to treatment at all, the folks who are just living in the community. So what Recovery Capital is about building nutrients in the community so that people don't have to be ripped out of their homes and away from their jobs and away from their families to go to treatment to get well in every case. And there are 3 rules. I don't know where I stole this. I can tell you it's not original, but I think it's brilliant, whoever said it first. 3 ways of thinking about these resources. Again, thinking about not just the what, not just what are the things that people in recovery need, but also how do they need to be delivered. And that's availability, accessibility, and acceptability. And availability is just like it sounds. Does this exist in our community? So I've been working with Johnson County, the CDC has identified as a county at risk of an HIV epidemic, but they don't have a syringe service program. And so we're having that conversation. So in Johnson County, we would say syringe service not available. If it's available in your county, but it's hard to get to, right? It may be inaccessible, maybe because of transportation, maybe because it's a stigmatized location, who knows? But thirdly, and I think most importantly, something that we don't like to think a lot about is this an acceptable intervention? Or is this being delivered in an acceptable way? So for instance, when I talk about the 38% who won't go to treatment because they don't want to be abstinent, that's an example not of a treatment availability problem, and it's not a treatment accessibility problem. That's a treatment acceptability problem. These folks find that kind of treatment unacceptable. And what I want to suggest to you is, I don't have the answers, but I think I have some good questions. And one of the questions is, how can we create interventions? How can we resource people in a way that they find more acceptable? And you may be inclined to say, the way that I was initially, why should we care if they like it, right? They have drug problems, they need help, we should give them help regardless of what they like. And that's fine, except if you think about it, and research supports this, if people don't like the intervention, there's more attrition, right? They're more likely to drop out and less likely to engage. And thus, we have less of an opportunity to positively impact that person's life and provide net benefit to our communities. So the big gaps become, how are we working with people who are actively using drugs in our community? How are we doing harm reduction with those folks? How are we working with folks who aren't going to find their way to treatment? And then broadly, how are we working with folks even who did go to treatment? How are we supporting them in their transition out of treatment and in the community? I know I'm bumping up against time, so I'm about to wrap up, but quick thought about acceptability. In sort of the racial discourse that we're having right now in this country, sometimes you'll hear people say it's not enough just not to be racist, but you got to be actively anti-racist. I think there's something similar that could be said about stigma, that it's not enough to just not be a person who uses the word junkie, right? but we have to be actively trying to create spaces that are hospitable for people who have substance use disorders. So this is a paper that was published about a decade ago in Frontiers in Behavioral Neuroscience. And essentially what it says is that throughout history, people have sought help in groups. People who have addictions have sought help in groups, sort of organically. And that's not surprising, because fundamentally what addiction is in the brain is a dopamine deficiency problem. You don't have enough dopamine effectively. And what social interactions do is upregulate dopamine. In other words, pro-social interactions are quite literally medicine to heal addicted brains. And so now think about the impact of stigma when what people need most are these pro-social interactions, spaces and interactions where they're accepted as they are. How powerful that would be, right? So it's not just about what are you delivering, but how are you delivering it? And are you making this a safe space for that person? Because if you're not, then they're going to be less likely to access that resource. So I'll 2 more slides and I'll be done, I promise, like 2 minutes. I don't know how many of you are familiar with the Marshmallow Test, but some years ago, researchers took kids into a laboratory, put a marshmallow in front of a child and said, hey, you can eat this marshmallow anytime you want. But I'm going to step out of the room for about 10 minutes. And if I come back, you still haven't eaten the marshmallow, I'll give you a second marshmallow, right? So we're sort of testing delayed gratification and discounting delays and some of these phenomena. And first of all, look at these poor kids. Those kids are tortured. My man in the bottom left down there, he is dying. He's trying not to even look at the marshmallow, right? And so whatever, interesting findings back then, but in 2018, some researchers replicated the study and collected data on socioeconomic status. And what they found is that kids who came from upper SES backgrounds performed better on the test. They were better able to delay gratification. And so why is that important to recovery? Well, in so many ways, what recovery is a quintessential microcosm of delayed gratification, right? Because in so many ways, you're experiencing anhedonia and depression and stress and all the issues and all the rewards of your hard work, your meaningful employment, your relationships, your improvement in quality of life. They're 3 to 4 years down the road, right? So we have a vested interest in resourcing people, because when people have enough, they're better able to sit it out. They're better able to bite the bullet and hang in there in recovery. And last one for you. Some researchers also in 2018 replicated the study, but they randomized kids to different colored t-shirts. So they randomly put kids in blue and yellow and red t-shirts. And right before they went in the testing room, they said, you know, you kids in blue t-shirts, the reason we put you in those shirts is because you're really patient kids. And there was no truth to that, right? It was completely blindly randomized. But the kids went in to perform the test, and the kids in blue shirts outperformed the other kids systematically, right? And we found something similar in addiction treatment. People who go into treatment believing in their ability to accomplish their goal are better able to accomplish their goal. And so this is kind of just my plea for hope, right? For hope, even for people who continue to use and continue to use, hope is something that you can't lose sight of, because it's sort of the engine that's going to get people there. Last slide, and I'm done. I'm going to blast through this because we don't have time. Last slide here. Talk about language. My favorite study I've been exposed to since I've been at UK. This comes from a guy named John Kelly, who runs the Recovery Research Institute out of Harvard. And he performed this study at a summit of mental health professionals. So these are folks who in theory should understand a lot about addiction and recovery. And they created a vignette, or a short story, about a man named Mr. Williams. And according to this short story, Mr. Williams is in a drug court program. He tests positive on his urinalysis. And the question is posed, should we send Mr. Williams to jail, or should we send him to treatment? All right, it's a pretty basic scenario. It's also, I think, a fairly practical scenario, pretty realistic. All of the short stories that the research team handed out were exactly the same, word for word, except for one phrase. In half of the vignettes, Mr. Williams was characterized as a substance abuser. And in the other half, he was characterized as a person with a substance use disorder. And that's a seemingly insignificant difference there, but it had really profound results. The mental health professionals who received the vignette that said that Mr. Williams is a substance abuser were more likely to hold him responsible for his positive urinalysis and send him to jail. In contrast, the mental health professionals who received the vignette that said that Mr. Williams is a person with a substance use disorder were more likely to suggest he get an opportunity to treat his disorder. And I love this for a couple reasons, mainly because I'm a millennial, and as such, we take a lot of crap from baby boomers about how we're snowflakes and we wilt and we're too politically correct. And guess what? This isn't about political correctness. This is empirical evidence that shows that language really matters, because the way we talk about addiction is constantly informing the way we're thinking about addiction. And the way we're thinking about addiction is informing the way we treat people, the way we resource people, the way we regard people with substance use disorders. So I'll just finish by saying, just be conscious of the language you use when you're having these conversations, because language really matters. So thank you all so much for having me. I don't think we have time for questions, but I'll put up an email in case you guys want to reach out and have a conversation.
Thank you so much, Alex. And you reminded me of a language-related resource that I'm aware of. The Institute for Rural and Community Journalism, which is housed at the University of Kentucky, did a workshop. It's probably been about 2 years ago now. That was about language use and covering the story of addictions. And I read through it, even though I'm not a journalist, and found it to be really, really helpful to figure out what to say and how to talk about it. So that's a link that I'll dig up and share with the attendees as well. So thanks so much for mentioning that issue. It's a really important one. So we will turn now to our next presenter. Bill Sandell is a workforce development consultant in the Office of Employer and Apprenticeship Services at the Kentucky Education and Workforce Development Cabinet. And Bill is sharing his slides with us now. So we'll turn it over to you.
Yes, thank you very much. Like Carrie says, I'm a workforce development consultant with with Kentucky's Education Cabinet, and the reason I'm here is to share a lot of the resources that we at the Kentucky at the Cabinet and the Career Center have to help with recovery. You know, as was mentioned, you know, there's all sorts of aspects that help with recovery, and you know, it's not just one single solution. And one of those big solutions is good, stable employment. And our office is really a part of a big strategy statewide to respond to the needs of employers and to really to get the workforce going, and especially now with everything going on with the pandemic, you know, we really want to get people working and get people out of the really the problems that have come up in their life, and getting somebody a good, solid, stable job. That's really our goal. And there's a whole host of resources that we offer from the cabinet and from the local career centers. You know, it's not simply federal bonding, which is what I'll be talking about in just a minute. You know, when you go to the local career center, you know, there's recruitment, there's customized testing and training. You know, we can provide all sorts of these resources to help individuals not only get themselves ready for employment, but help them find that new job. And you know, we have lots of strategic recruitment as well for veterans and diversity and second chance and all that kind of stuff like that. And we are here to try to help people get to work. And like I said, work is a big aspect of recovery. You know, having a good, stable job is one of the key factors in promoting recovery. Excuse me. There we go. And like I said, we are partners with all sorts of organizations, like our technical college system. You know, the state here has lots of different programs to help get folks back to work and help get folks into not just a job, but really a good, solid career. You know, whether that's on-the-job training, incumbent worker, or even the thing we're really trying to promote is registered apprenticeship. You know, that's a good, solid, stable career, not just a job that will you know, put food on the table, but a career that will help somebody succeed, not just now, but into the future as well. One of the big programs we also offer is called the Work Opportunity Tax Credit. That's a federal program that our state manages and our office manages. This provides a tax credit to employers if they hire from one of these targeted groups. You know, an unemployed disabled veteran, and I myself am a veteran, and unfortunately, veterans are one of the key demographics that struggle with substance issues and alcohol issues. You know, if a unemployed veteran applies for a job, they can get a $2,400 tax credit that company can get. You know, that's a great incentive for a company to give this guy a chance or this girl a chance to get a job. And it's a real easy process. You can just go to that website, and it's just 2 forms, and we take care of it that way. But the big issue why I'm here is to talk about federal bonding. This is a federal program that was started back in 1966, and Kentucky now is a full-fledged member of the program. We for a while now we weren't part of it, but now we are here to offer this to every single employer in Kentucky. It provides a fidelity bond that protects the business against fraud or dishonesty. So things like stealing, theft, and all really any sort of variation of stealing. And it's a $5,000 bond. And so it can be issued up to even $2,500 depending on the position. For example, we had a car dealership in Kentucky here where they wanted to hire someone who had a troubled background, but the problem is they would have access to the keys to the cars, to the vehicles. And so that was one of those individual cases where we upped it to the $25,000 limit. And it's a 6-month bond, and it can be renewed for an additional 6 months at no cost to the employer. This is a completely free program. It's to the employer. It's no cost at all. And like the slide says, it's an extremely successful program. Only 1%, less than 1% of the bonds has ever had to be filed upon, because one of the key issues in recovery is getting a good job. If that employer gives you that has been struggling to find a job a chance, and they think, well, I don't know if I want to do this or not, but hey, I can get this bond, and it'll give that employer that peace of mind. Who is eligible for this? Ex-offenders, individuals in recovery, people on public assistance, poor credit, dishonorably discharged from the military. It's really for anyone that needs a bond to prevent them from either being fired or to get a promotion or to get a job. Now, it doesn't cover against poor workmanship or injuries, self-employment, things like that. And if you've already defaulted on a bond, then they're not going to give you another one. So don't think you can pull one over on us. But really, it's something that can give peace of mind. That's the big thing, because employers, they want to hire, but if you've had some issues in your background, there's a reason why those type of people are ones that struggle to get jobs. And we here, from the Education Cabinet and the Career Center, we want to provide that peace of mind to a business to give that person that second chance. It gives them assurance that that if something happens, they'll have limited risk. And like I said, it's an extremely successful program. Less than 1% have ever had to be paid out. And it protects their assets, protects the business's assets, and improves employment outcomes, and it assists in meeting hiring requirements. It's really a win-win. There's nothing to lose by participating in this program. And we have a whole host of bonds ready to go. All you need to do is contact our office, and we can help you get that bond. If you want more information about the program in general, you can go to bondsforjobs.com. And if you have any questions, you can just reach out to us at workforce@ky.gov. Like I said, in federal bonding, like I said, it's not the only thing we do. It's just one of our big programs we're trying to promote, especially with issues of recovery. Getting a good job for somebody is one of the key aspects to help them get out of the problems they've been dealing with, and we're here to help.
Thanks so much, Bill. That seems like such a fantastic program. I only just learned about it about a year ago while I was attending a workshop, and I've worked in economic development for 15 years. And so it, I think, is a program that not enough people know about and talk about. So thank you so much for sharing about the federal bonding program and the other resources. We are going to move on now. I'm going to turn things over to Jennifer Irwin to facilitate our next panel discussion. Jennifer serves as the Director of Residential and Outpatient Services for Hope in the Mountains in Prestonsburg.
Good afternoon, everybody. How's everybody today? I'm really, really grateful to be here. I think this is an amazing webinar, and just panel discussion on how we can address addiction from a holistic approach. And we are very blessed to be joined by a panel with a breadth of experience today. Our panelists are Gene Deathridge Jr., the Outreach and Engagement Specialist with the Fletcher Group, who will share about his work with supporting recovery, including housing. Cody Gibson, the Managing Partner of Above the Line Consulting, who has a focus on transformational employment. And Rodney Cool, Business Coach for the Kentucky Small Business Development Center, who is a tremendous asset for the success of small businesses. Small business is a key aspect of regional economic resilience, and entrepreneurship can be a pathway to economic stability for individuals in recovery as well. So let's start by hearing from Gene. Gene, recovery housing is a key part of the picture for supporting people with substance use disorders in their recovery. Would you care to share about your work in recovery housing and the Fletcher Group?
Absolutely. And I want to thank everybody for having me today. And I also want to thank everybody for being on this call, especially in light of the pandemic. You know, it seems the opiate crisis has lost a little bit of the spotlight, and understandably so. So I work for the Fletcher Group. We are a nonprofit founded by former Kentucky Governor Ernie Fletcher. During his administration as governor of the Commonwealth of Kentucky, he started the Recovery Kentucky programs, which there are 18 of those centers across the state serving men and women, total of 1,800 beds. And they were really built on a housing first model. Our co-principal investigator for our grant is through UK, the Kentucky Injury Research Prevention Center. And, you know, everything that I've heard today is incredibly poignant. You know, I often speak to groups about, you know, kind of what I think of as the three-legged stool that you have to have in place when somebody completes a treatment program or otherwise decides to engage a recovery lifestyle. And, you know, if you imagine a three-legged stool, if you take one of those legs away, you're not going to be able to sit on it. It's going to fall one way or the other. And those three legs really are, you know, stable housing, transportation, and a job. If you have a job but you can't get to the job, you know, if you have a job and transportation but nowhere to live, you know, you're still in a pickle. So recovery housing really focuses on providing a safe and sober living environment for individuals to occupy after they have completed a treatment program or otherwise want to engage that type of service to continue their recovery lifestyle. And it, you know, it really hits on a lot of the things that we got to hear Alex talk about today. You know, it provides people with a social environment that is conducive to and supportive of their recovery. It's based on the social model of recovery. And so you're sharing a space with other individuals that are experiencing the same stressors and difficulties that you are as you're pursuing recovery. And you're able to share experience, strength, and hope with one another as you know, try to move forward. And so usually the average length of stay in recovery housing is anywhere between 12 and 18 months. And there are a lot of great partners and folks working to provide these services here in Kentucky. For our part, we're funded through HRSA, the Health Resources Services Administration, to establish the Rural Center of Excellence in Recovery Housing. And so what we do is we provide free of charge technical assistance to individuals and organizations seeking to expand the capacity of recovery housing in their communities or otherwise improve the quality of existing recovery housing in their communities. And I'll be sure to share all my contact information in the chat box at some point.
Thank you, Gene. Next, let's hear from Cody. Cody, your focus has been transformational employment. Can you share with us a little bit about how transformational employment can happen and what steps employers can take to be supportive of recovery?
Yes, ma'am. And first and foremost, thank you, Carrie, for putting this all together. And also thank you, Jennifer, for hosting this panel. I also want to give a small shout out to my good buddy Gene there, fellow bright Kentucky graduate now, and so congratulations on that, Gene. Let me back up a little bit and kind of show you or talk through how I got thrust into this. I currently chair the Skyhope Women's Recovery Center here in Somerset. That was a project my father started way back, and saw it through its inception and opening, and I kind of took over from him once that happened, as they changed over the board. Part of what the problem we were seeing with our clinic here was people were getting through it, were graduating, but the next step wasn't there. There wasn't any follow through. There wasn't anywhere for them to go once they completed and worked so hard to get through the programs. I sit on also the Somerset Pulaski Economic Development Authority, and it's a new board that we put together to really boost economic development in our area here. One of the biggest challenges we saw was we did not have a workforce due to the drug epidemic. So the first thing we identified was we have to get employers bought in to this whole transformational employment model. Now, how do we do that? How do we go about that? That kind of was us as board members. A lot of us had businesses, or a lot of us knew people that had businesses, and we kind of agreed that we would move forward as a community of rehabilitation. We wanted to be a community that welcomed those who were in recovery, and that we were a community that would be here as an asset within your recovery. That wasn't easy. We had a lot of meetings with a lot of employers, and it was tough because, you know, the stigma of addiction is there. The stigma of someone coming through treatment is there. But on the backside of it is these individuals are actually better employees once they finish recovery. Once they get through recovery, they are stronger employees than the average millennial even. So we put together this model, pushed it forward, and essentially had 4 or 5 of our big employers here in Somerset commit to hiring these individuals right off the bat. One of them that I wanted to highlight was a gentleman by the name of Daniel Cheshire. He owns several Dairy Queens as well as some other businesses, and he was kind of the cornerstone for getting this program started. He hired several individuals. In fact, a lot of them are still with him today, which every time I go through there, I love to see that. And he took it upon himself to really get out and spread the word of the success that he had with this. So to, kind of circling back, what steps employers can take to kind of help these individuals and be supportive of them. And this is something we had to go outside of our community to find the answer to. And we went to Lexington, and the gentleman's name's slipping my mind. He has a restaurant up there, but he hires a lot of people in recovery. And basically his biggest takeaway to us was, you got to structure the schedule for them to be conducive to their treatment. So if you know that their meetings are in the evening, or if you know their meetings are in the morning, don't schedule them then. Another big thing, a lot of these individuals in recovery have never really taken care of themselves with eating right or taking vitamins. And he impressed that upon them. Our people here are doing that as well. In one of our factory settings, we have a manager that teams up with these certain individuals who are coming into the loop that are in recovery, and they basically have an extra crutch, an extra person to rely on through their initiation. So if there's any problems, if there's any additional stresses, they've got a resource to lean on. I have to say I'm extremely, extremely proud of our community here in Somerset. We have made leaps and bounds. I would venture to say the stigma is almost gone. People are going way outside their bubble. In fact, they're reaching out to the Skyhope Center weekly, wanting to know if they have anybody else ready to step outside of the program. And I know now we are looking forward to working with Gene and the Fletcher Group on some next step housing here in Somerset.
Thank you so much, Cody. I'll definitely be reaching out to you for resources on how to rebuild that in Hazard and Prestonsburg. Okay, now let's turn to Rodney. Rodney, do you care to talk with us a little bit about what you do as a business coach and why that type of support is important to the economy and to recovery, and maybe speak a little on like how entrepreneurship can actually be a realistic goal for people in recovery?
Thank you, Jennifer. I appreciate it and glad to serve on this panel with Gene and Cody. I'm a business coach for the Kentucky Small Business Development Center, and we're housed at the University of Kentucky through the College of Ag, Food, and Environment. And what we're able to do is we are able to take federal funds through the SBA and be able to provide coaching and assistance for businesses across the state of Kentucky. And all that's done, that I like to say, is free. And we know there's not many things that are free, but we do provide free assistance for businesses throughout the state of Kentucky. One thing that we're well known for is being able to take someone's idea and help them put that down on paper through a business plan. And we take them step by step through the business plan and also putting cash flow and financial projections together and have them ready to go to a bank to get funding if they need that. Or sometimes they may just need to be able to put this idea down on paper so they can see what it looks like and have someone else's opinion. So we definitely do a lot of coaching in helping that client understand that. Now, since we are talking about substance abuse disorders and other things that go along with that, we have helped several members who have either come out of drug treatment programs or even out of incarceration to help start a business because they found it very difficult to get a job or to do what it is that they wanted to do. So we've been able to assist several members. Two of them that I have as my clients are construction companies, which both members or owners of that construction company were substance abuse recoveries and have gone on to have very successful construction company, both in Lexington and in Louisville. So they hire a lot of people that come through those programs, and they do, just like Cody and Gene had mentioned before, they have a provided structure for those people. So they don't just send them to the job first. They do make them come to the office first, and they're kind of checked out before they're sent to the job. And they have made people go home because they either came in, either intoxicated or under the influence. And then they've been able to help consult and coach them through their recovery process again, or to, when they've relapsed. So that's a great one. The other one that I've been able to help is a gentleman who came out of incarceration for some other things and has started a staffing company. And just like I think it was Alex or Bill had mentioned, the tax credits, because he came through that and started his own company and then helped a couple of family members who had companies to hire some people coming through that. They were able to get those tax credits, which they both were able to get the maximum of the $9,000 tax credits. So those are great incentives for businesses to help those in recovery to get some tax benefits for doing that. Now, what I'm going to go back to and get back with Bill about now is this federal bond program that I did not know about until just now. So that is another program that I will work with my staffing person so that he understands how he can use that in recruiting businesses who can help hire people through this process. But those are just some of the things we do. I've certainly enjoyed working with my people who have come through struggles. In my last position, I was Department of Vehicle Regulation in Frankfurt. I was the commissioner there. And one of the other programs that I was able to implement while I was there and wrote it actually into the Real ID Act under former Governor Bashir, was to help those who come out of incarceration or through treatments that have maybe lapsed a driver's license to be able to get an ID. Because it's very important. That was one of the things that the Department of Corrections and the Federal Bureau of Prisons came to me when I was commissioner and discussed the inability for these people to get a job because they didn't have any type of identification. So glad that we were able to write that into the Real ID Act, how we could address that situation. And I certainly appreciate the Department of Corrections and the Federal Bureau of Prisons bringing that to light to us so that it was something that we could get resolved. I'll turn it back over to you, Jennifer.
Thank you very much, Rodney. Just thinking about my own personal experience, I am a product of a recovery-oriented system of care. I'm a person in long-term recovery, and I grew up and did all kinds of dirty deeds and recovered in Hazard, Kentucky. And so my community really just wrapped their arms around me and loved me up and gave me a job when I was unemployable and helped me with all kinds of different resources. I will say that for the most part, I came to know about those services almost on accident. Just different things, like I was able to work when I first started college with the Ready to Work program. I was a single mother, and because I was in that program, I was introduced to another program, to another program, to another program. And I was really, really blessed to have some people that were passionate about me as a person and really believed in me when I didn't have a whole lot of faith in myself and my own ability to get a job and to provide my own transportation and to be a parent and to kind of, for lack of a better way to put it, to kind of change my reputation in this small town. Because that is a huge barrier, is, like Cody was talking about, that's an amazing program that you guys are doing in Somerset. On just, especially if you go back to the same rural community that you grew up in, and that people know you, people have your number, as they say. And so kind of overcoming that stigma on a personal level and then, addressing it from a macro concern is pretty impressive. So here's my question for you guys now, is how can we get the word out? Because some of these programs that we've discussed today, I've been working in treatment for 10 years, and I had no idea about the federal bonding program. I hire people every day, no idea. Most of those people would definitely be covered by that program. And the things that you were doing, Rodney, with coaching and I had some knowledge about what Jean does with the Fletcher group and things like that. So do you have any ideas on how we can get this information into the people that are like boots on the ground that would be using that information in the day-to-day work?
Well, unfortunately, we're like everyone else. We don't have a very large marketing budget, so we do have to rely on our partnerships and our other agencies to help us at the Kentucky Small Business Development Center get our services out. We rely on banks to send customers to us. We rely on our chambers and our economic development people to do that. And so that's really about the only way that we have a way of gaining clients and for us to help them. And so, we really rely on a lot of referrals to our group, just like probably everybody else in here does too. They rely upon the referral business. And so, I wish there was a better way. We're trying to definitely do more marketing. We had discussed just a couple of weeks ago about placing billboards maybe across the state a little bit to try to help with some of that. But, there will definitely be few and far between. Facebook, we do have Facebook pages, each center. There are 17 centers across the state of Kentucky, and we do just like, I think it was one of the radio stations, we go from Pikeville to Paducah. We truly do stretch all the way from Pikeville. We have an office there all the way to Paducah. So we're all the way across the state of Kentucky and north and south as well. Of course, I'm out of London, Kentucky. And we do have offices in Northern Kentucky and Covington at NKU and in Covington itself. So, but I wish we did have a great, huge marketing budget, but we don't. So we have to rely on everybody else to help us put all these people in business.
That's absolutely true. I think that that's probably true for everybody in here, that nobody has a big, I know I don't have a big marketing budget. And so word of mouth sort of thing. So maybe Carrie can help us with that. She can put these Zoom meetings on over and over and over until we get everything we need. Cody, my next question is for you. What do you think that your biggest barrier was in like building that community support? And like, I would assume that would be, you know, kind of a leap of faith for the people that first participated in your transformational employment program. And so, do you have any suggestions for maybe, you know, for anybody that wants to redo that, myself included, that want to kind of rebuild what you guys are doing in Pulaski County? Like, what were some of the barriers that you saw on the front end?
So it's kind of like with anything else, you kind of want your best players on the field per se. So we were very selective with the individuals that we put out into the workforce to begin with. We wanted the 3 or 4 best girls from the center to get out and lay the groundwork, lay the foundation in these restaurants and in these different places, these factories. Just because we want, you know, if you're going to take a chance, you don't want a sour taste in your mouth right off the bat. I know that's kind of counterproductive in a way, because you want to get everybody else employed and out there to be seen as well. But you know, for us, we took the path of let's get the best ones out there that we know will work the hardest, and we'll lay that foundation. I kind of wanted to go back and piggyback when you were talking about, you know, kind of getting back into your community. Let me turn it around on you, Jennifer, and ask you a question. Did you have a distrust towards the community at all when you were putting yourself back out there?
I did. I really, really did. It was, I don't want to say a distrust as much as a shame, I guess, you know, on God, can I really do this? Can I really go back out there when I mess this job up, or when I'm going to, you know, go and try to apply for this, and I have all these gaps in my employment, and how do I even explain that? And so, lucky for me, I was given a chance. I, you know, kind of made a full circle move back to Hope in the Mountains, but I wasn't able to get a job in Hazard. My story, and I could go for days on this, but my story is that I put a whole lot of job applications in, jobs that, you know, I could have gotten, but like I was sharing, that my reputation preceded me. You know, I used drugs in this community for almost 15 years. That's not something that goes away, that reputation, overnight. And so I couldn't get a job in Hazard as a result of not being able to get a job and needing like something to do, like, you know, like Alex was talking about earlier, needing, you know, a purpose and needing somewhere to show up every day. I went back to college. I had no intention of going to college when I got clean. I wanted to get a job and, you know, regain custody of my child and buy a car and a house and a throw pillow and that kind of stuff. But that wasn't what happened for me. I went back to college. Thank God I did, you know. I'm now like a year away from a PhD, so it all worked out how it was supposed to. But I got a job in Prestonsburg. And so that and I got a job with an employer that is, you know, great. And I work there now as the clinical director. And Renee and Jimmy at Hope in the Mountains are great to hire people in recovery and give them a chance and kind of teach them how to be grown-ups and teach them how to work and those kind of things. So those were my experiences. But over the years, I've been able to rebuild some of those connections that I'd lost and that were kind of shattered due, you know, strictly through my actions in Hazard, and kind of watch. I think it's really good for the community too to be able to see somebody through the entirety of the recovery process, to see somebody using drugs and to go to treatment and to, you know, kind of crawl before you walk into recovery. I think that's really, really, really important for people to see that recovery is possible. So we tend to focus on the negatives and not the.
Well, I asked you that because the flip side of that coin was the second hurdle we really found was the confidence level of the girls to go out and actually want to interact with the community. So we walked that one backwards as well and started having local clergy come in and serve meals. Churches take their holidays away from their families and go serve, like my church goes and serves on Thanksgiving. We have our local officials are in and out of the facility as frequently as they can possibly be, giving hugs, shaking hands, sitting down and actually working on resumes, that sort of stuff. So that was another big win that we saw, was the community has to go to them too. It's not just the girls coming out to the community. The community's got to go to them and got to hug on them and love on them and let them know that, you know, we're here for you and we'll do whatever it takes. And, you know, we know you have a past and that's okay, because everybody does. So that's why I asked you that.
That's absolutely true. You know, just people being really, especially now I work with women in recovery, and just the fear that comes along with taking that initial step out. So that's a really good way to address that. So Jean, let me ask one more question. I know we're kind of running short on time. I could go. God help you, Carrie. Ask me to talk. I could talk for 3 days. Jean, tell us a little bit about how the Fletcher group, do you guys work with like treatment centers that are already existing and like navigating? I'm just thinking, you know, I'm thinking from my position, I have a lot of clients that go through residential treatment and then definitely need those services. So is there a way that you are already coordinating those services with maybe residential treatment or outpatient treatment centers? And if so, how do we get on board with that?
Sure. Real quick, I want to piggyback briefly onto Rodney's question, a quick comment on Cody and your discussion. What for Rodney's, the Kentucky Smart on Crime has a working resource guide, and I was trying to find the link for it, and maybe I can send it to Carrie or Robin later if I'm able to track it down. But they're working on developing a statewide resource guide, which of course, you know, that's only ever half the equation. You know where something is, you might know some of the resources, but still, you know, that warm handoff is critical. You know, I've spent a lot of my past year and a half in this position, you know, just really trying to cipher through, you know, how do we interconnect these broad systems. Rodney mentioned it in the chat. You know, there's probably hundreds of thousands of dollars in state and federal money that goes unutilized or underutilized just because people don't know about the services or know how to refer people to it. And it's an ongoing problem. You know, it's hard to keep that encyclopedic like knowledge of, you know, so and so does this, so I'm going to send A to B. But and then, you know, to Cody's point, I'm a person in long-term recovery as well, and you know, just that, you know, that really re-entering the society piece is extremely difficult. You know, there's a big degree of cognitive dissonance, you know, that the individual experiences. You know, it's hard to go from society looking at you as a pariah and a criminal, and then like suddenly you're okay because, you know, you went to treatment and you're trying. You know, an individual doesn't make that shift overnight. You know, I had that experience myself. You know, it took me a long time to feel comfortable about living in the community that I live in and getting back to work and, you know, involving myself in local affairs. You know, people gave me opportunities through social capital, but to touch back on what Alex said again, you know, the language piece is critical. You know, if and the stigma piece is ongoing, and it's hard to get past. But to get back to your question about recovery housing and, you know, what are we doing to help develop, you know, the reference resources and the infrastructure for that. Part of the Rural Center of Excellence's mission through our 3-year HRSA grant, we're in the middle of the 2nd year, and we're working with UK on this as well. We're developing a online website which will have a repository of all recovery housing options through the Commonwealth of Kentucky. That's not up and that's not running yet. You know, a good stopgap is always Oxford House. They have, I think, 76 houses throughout the state of Kentucky. They're still actively working on expanding into Eastern Kentucky, but they have a lot of problems, not with their model necessarily, or not even with finding houses or landlords that are willing to work with them. It's just, you know, they have to be able to put a house in a place where folks are going to be able to walk to mutual self-help meetings or walk to a job, or otherwise there's some sort of transportation system in that community that can help them get where they need to go. And a lot of, you know, the small towns don't have, you know, a very reliable bus system or something like that. So beyond Oxford House and the website that's under development, you know, hopefully that'll come along soon. It's going to be really similar to the treatment locator website that UK developed a couple years back, gethelpnowky.org. I always make that plug. Any presentation that I get, you know, write it down on a sticky, keep it next to your thing, because you never know when somebody's going to approach you, or you're going to hear about somebody that needs to find, you know, a resource. And that's a great resource that our state, you know, put a lot of work into developing. But so hopefully that will be up in the next couple years, and that is in direct conjunction with an effort that is being undertaken by the Department for Behavioral Health and Intellectual and Developmental Disabilities here in Kentucky. We recently, about a year ago, started the process of developing what is called a NAR affiliate. NAR is the National Association of Recovery Residences, and so the state is in the process of creating a certification system for recovery housing operators throughout the state to apply to become NAR certified recovery housing. And that's simply a measure of quality. If you work in any kind of behavioral health care, you might be familiar with CARF accreditation. It's somewhat similar to that, but they're in the process of rolling that out here at the state level. They're doing a couple pilot groups right now. Sometime in the next few months, that'll roll out to all the recovery housing operators. And so in the meantime, as far as finding, you know, immediate resources for a client, I always welcome any and all inquiries. I have a little bit of data that isn't public and I can't make public right now, but I'm always more than happy to try and help connect people to what they need.
Thank you very much, Jane, and to all the panelists. This has been a really great discussion. I know it's given me a whole lot of takeaways, and I'm probably going to email you guys and irritate you from here on out. So thank you very much, and we'll turn it back over to Terry.
Hey, Jennifer, I want to say something before we leave this topic, please. First off, I just want to applaud you, Gene and Alex, and any others that are on here that have been through that recovery for making it through and showing that you can do it. And I applaud you as well as telling your story. And I understand that it's not easy, but I do appreciate you and your honesty, and Gene and Alex talking about, you know, the trials and tribulations that you all have been through. So I just wanted to give you an applaud for being able to come out and talk a little bit about your all stories.
Thank you, Rodney. I appreciate it.
Thank you, Rodney.
Yes, that is absolutely true. That's really important to breaking down that stigma like Alex was talking about as well. We often hear people say that we need to meet people where they're at, but I think we also need to be cognizant of our own assumptions and not assume where people are when people may be in a totally different place, like you were saying, Jennifer, where we really need to be open to understanding where they are and meeting them there rather than meeting them over here where we think they might be. So that's really important. Let's take a moment and turn to the chat. There's a question that Natalie has posed. There are 2 identified ties to higher education and the opportunity that it provided to those in recovery. It sounds like a supportive environment. Is there a program specific to the university that assists individuals in recovery while pursuing their post-secondary degree? Pursuing a post-secondary degree is challenging. If there is a program, is it unique to UK? I don't know if that's something any of you have an opportunity to speak about. Yeah, go ahead, Jean.
So during my undergraduate education, I worked to try and establish what's called a collegiate recovery program. It's a form of recovery capital support. They have a national association, the Association of Recovery in Higher Education. And you can visit, like, you can like Google that, and you can find out which specific colleges have collegiate recovery programs. They're essentially social clubs for students and individuals living in a recovery lifestyle. The University of Kentucky does have an active collegiate recovery program. Alex started that when he was doing his undergrad. I wasn't as successful at MSU through no fault of their own, just budget cuts and stuff like that. The state's been dealing with for years. But yeah, those are really important. I can share a little bit from my personal experience. You know, I last May I finished a master's in public administration, and you know, I'm fortunate. Like, I have a really good recovery support system in my life that I've built over the years. But you know, there were some major you know, I'll use the word discriminatory barriers that like I had to overcome, you know, despite having already finished an undergraduate program at this same institution, that I had to deal with and overcome, you know, because of some of my past stuff. But there are all kinds of resources. Lindsey Wilson College offers free master's programs for those in recovery and pursuing social work degrees, and there are a variety of other resources. So I hope that gives some answer to Natalie.
Thank you. That's helpful. All right. Well, I wanted to connect the dots really quickly between the two workshops that we've done so far. Jean mentioned the three-legged stool of having housing, employment, and transportation. And in our panel today, we've talked a bit about the housing and from Jean's perspective, and Cody and Rodney talked about the economic side. In our previous workshop that we held 2 weeks ago, we talked quite a bit about transportation. And I just wanted to point out that all of Southeastern Kentucky is served by transit agencies. They all have limitations to the kind and amount of service that they can provide based on the amount of funding that they have available. But they all do have websites that provide information about how to access their services and how to get a ride. So I wanted to just put that map up and let you know that all of Southeastern Kentucky is served by at least some form of transit. So we're going to move now into group discussions. We're going to break out into two groups. And when we do so, please do feel like you can turn on your camera, unmute yourselves, and talk to each other. You're also welcome to use the chat if you want to put things into the chat that way. We are going to split into two groups that are both going to discuss these same questions. How can we address substance use disorder in the workforce? What coordination currently exists between services? And where can coordination be expanded? How does mobility tie into substance use disorder recovery needs? And what are the biggest opportunities? Where can you see those opportunities for coordination or for expanding services? We're going to break into two groups, and those will be facilitated by Joe Jacobs with Big Sandy Area Development District and Robin Phillips with National RTAP. Go ahead and move now. We had an interesting conversation in group one. I hope you guys had a good experience in the breakout groups. As we wrap up today's workshop, I want to hear from our facilitators about the discussion in the breakout groups. So Joe and Robin, if you guys could share some of the highlights from your groups, and other folks, feel free to unmute and chime in as well, or you're welcome to type in the chat with what some of your highlights and takeaways were from that group. Let's turn to Joe first.
So one of the things that we talked about is about how we could sort of support employers in creating places with a atmosphere of transformational employment. We talked about one of the things that we could do is, simply asking employees if they need help and making sure that employees know that resources are available, because a lot of times that's a barrier that they just don't know that you have resources, and sometimes we don't ask if those are necessary. So that was a big thing. And we talked about, especially if you're offering second chance employment, or even if you're not, how you could create an atmosphere that sort of reduces things like absenteeism and tardiness and those sorts of issues. And one of the things that we talked about in our group that some of our folks have had really good success with is just doing sort of a daily check-in. And we talked about the idea of bringing folks together at the beginning and the end of the day, or right before or after shift changes and that sort of thing, to kind of talk about the plan for the day, what kind of needs they might have, and taking a team-based approach to structuring your workforce and checking in with folks. We also talked about how that has changed right now with so many people working remotely and how we could continue to do that. And some of us have had some experience in trying to do that in virtual settings like a Zoom meeting and that sort of thing as we move forward. And that still seems to be helpful for folks if we do that even virtually. Troy mentioned something that was a very unique way that we might be able to do that, that also addresses health and mobility, is to sort of take those resources outside. If you're going to be able to do those meetings, you can do them not just in the office, but to get out, take a walk on your city streets, or have your staff meeting on a trail or something like that, and get out of doors. And that's something, as we're socially distancing right now, that's another helpful resource. Although I know it's turned cold, as much as we can do that when the weather permits, that I thought was a really great resource. We also talked about some housing barriers that we experience, and how one of the barriers to creating a recovery ecosystem in all of our communities is lack of housing, sort of lack of stock, not being able to connect people with the right housing resources that we need to, and then some legal issues that folks may have that create extra barriers to housing. We also talked about transportation as a significant issue, oftentimes a barrier, especially in rural areas, because we don't have as many public transit options available, and some of the ways that we could talk about that. But I don't want to dominate the discussion. If anybody wants to join in with any observations from our discussion, please feel free.
Yeah, folks, you're welcome to type in the chat or to unmute if you have something to add. And Robin, can you share quickly what happened in your group as well?
We had a really good discussion with, the people brought up the issue about policies and workforce, and how do we build the recovery community and that recovery environment within communities. And what came up again and again is the need for better information sharing, and people don't know about some of these programs, whether or not they exist. And then the stigma issue is people don't know about addiction either. So that sometimes people's understanding about what addiction and substance abuse recovery mean, and what are the resources that are available to people. And I think that the community can be wonderful, but there are always going to be people that are not as aware and not as open. And so what we were talking about is just how do you bring resources together? The coordination among services happens, but it isn't systematic. And it seems like there would be it would be useful to sort of start cataloging the points of connection and making sure that information is being shared. We had Tiffany from the Transportation Cabinet talking about the interlock system, and that is an interface with the courts, and sometimes treatment is an interface with the courts, and treatment can be an interface. But then you look at those numbers, and 50% of people who are recovering from substance abuse are not doing it within treatment. 75% are not for alcohol are not doing it within the treatment framework. So where are the places within the community that you can open the opportunity up for people who are struggling to connect? And I thought it was really good when Jean was talking about places and that they had to look for housing that was accessible by walking. And the idea of people that are in DWE classes have 42 weeks of DWE. That's almost a year where you have to go every week and you have to participate. And that is really hard if you have to do you don't have a car and you have long distance. So I think that we looked at a lot of barriers, and we are interested in doing more activities to bring information together and identify approaches to being more engaged.
Yeah, well, thank you so much, both Joe and Robin, for that feedback. And thanks to all of our speakers for sharing your information. Thanks to all of you for attending today. I want to leave you with just a few resources. If you know of anybody seeking treatment, try findhelpnowkentucky.org as a way to find treatment. Treatment is not the only part of the equation, as we know from our conversation today, but these are some ways that you can find some additional information. And you can also find out more information about our organizations and our partners on our websites. We'll be in touch with the follow-up from today's workshop, as well as information about the additional workshops coming up in 2021. Thank you all so much again.
Additionally, in the chat, there is a SurveyMonkey link. We would love to hear your thoughts so that we can continue to improve these workshops as we go along.
Yes, thank you. Thank you so much, Nellie. I'd forgotten about that. Thank you all. Take care and stay safe.
Okay, thank you.